Hi everyone, I'm Dr. Brieanna Oldham, a veterinarian interning at CVets in Columbia, South Carolina. Come with me for a day in the life. Right now I'm rotating through emergency, so it's sure to be a busy day. With caffeine and work essentials in hand, I'm off to rounds. At least once a week at CVets, we gather in the conference room to either learn from one of our many specialists as they present a topic from their field, or, like this week, we review cases that didn't go as planned and reflect on how to improve the outcomes in similar cases to come. We take notes and ask questions or get advice that will guide us in the future. As rounds come to an end, I take the opportunity to chat with my fellow interns before we cheers our caffeine and head our separate ways for the day. I have some time before my shift this afternoon, so I head home and try to be productive. First things first, I grab some breakfast and relax on my couch. The picture of productivity. Next, it's time to get some water, because all I've had to drink today is coffee, and hydration is important when you're going to the gym. Once a quick arm day is out of the way, it's time to start prepping for my evening at the urgent care. The infamous snackle box gets packed with apples, chicken salad, cucumbers, banana chips, and more. I bring my laptop for keeping records, and my stethoscope is important for listening to hearts and lungs, and my notebook for jotting down notes. And last but not least, some fuel to get us through a busy night. As I head out the door, I grab a few essentials: my Vocera for communicating with other doctors, my x-ray badge when taking radiographs, and my lucky pen. And I'm off. I arrive a few minutes early so I have time to set up my desk and settle in. At the urgent care, we see patients with unexpected issues that aren't life-threatening but definitely couldn't wait to be seen by a primary veterinarian the next day. For example, I saw this cat who was limping, a dog who was vomiting, and a dog with an ear infection. I get to talk to owners about their pets and come up with plans to treat them. And I never stop learning from my fellow colleagues. Once the last patient is seen, we shut down the computers, pack our bags, and do some last-minute cleaning before we head out for the day. After a long shift of treating patients, it's time to get comfy. Once I'm in my comfiest clothes, I fill up my kettle with some water and put it on to boil. After a long day of going to rounds and seeing patients, my favorite way to unwind is a cup of tea and a good book. And that wraps up my day. At almost 1 a.m., it's time to say goodbye. Thank you for joining me, and we'll see you next time.